Muscles of the velum are muscles that connect the velum or the soft palate to other structures. The velum is an extension of the hard palate posteriorly. It has taste buds on the oral side and lymph glands that are part of the immune system on the nasal side. The middle front portion of the velum is composed of a tendon called the palatal aponeurosis. The remainder of the velum is muscle that ends at the uvula. The body of the velum is normally raised during speech to close off the nasal cavity. The velum is lowered for nasal sounds in speech and is also lowered for respiration. The levator veli palatini is our primary velum raising muscle. This muscle makes up the majority of the body of the velum. It originates from the inner sides of the temporal bone and the wall of the eustachian tube, which connects to your auditory system. This muscle courses downward and medially to insert into the palatal aponeurosis. This will help elevate the soft palate vertically and posteriorly, closing off the nasopharyngeal port against the posterior wall of the pharynx. I have 3 different images showing the velum and the uvula from various views here. In the lower left, an anterior view like you might have in an oral inspection. In the upper middle, a mid-sagittal section showing the soft palate as an extension of the hard palate, with the levator veli palatini muscle extending up from there to connect it to the superior part of the nasal cavity at the sphenoid bone. And then in the lower right, a coronal section view where you've separated out the front and back halves, or front and back parts of the head from each other, showing the velum underlying the entrance to the nasal passage. And the levator veli palatini acting as a sling underneath that nasal passage entry. The musculus uvulae is an anterior-posterior coursing muscle within the velum. The posterior tip of the velum is a landmark called the uvula, which one of my professors called the dangle-down thingy, so that always helped me remember what the uvula was. The musculus uvulae originates at the posterior part of the hard palate, the part of the hard palate that's the palatine bone. It runs the length of the velum to insert into the mucous membranes of the uvula. Contraction of this muscle will shorten and stiffen the soft palate. Here's an different oral inspection view showing the uvula and also relative to it the soft palate or velum and the landmarks of the anterior and posterior faucial pillars that overlie the palatoglossus and palatopharyngeus muscle, just to give you a slightly different idea of oral anatomy. The tensor veli palatini is a paired muscle that originates at the medial part of the sphenoid and eustachian tube wall, courses downward into a tendon that passes around the hamulus, an inferior projection of the sphenoid, one of those legs that hangs off of the sphenoid at the end of the lateral pterygoid plate. This tendon expands to join at the midline and become part of the palatal aponeurosis that runs down the middle of the soft palate. When the tensor veli palatini is contracted, that opens up the opening into the eustachian tube, which equalizes pressure in the middle ear. The palatoglossus muscle underlies the anterior faucial pillars on the side of the posterior oral cavity. This muscle originates from the palatal aponeurosis that runs down the middle of the soft palate and goes around the sides of the oral cavity to insert into the posterior tongue. So this muscle can be used either to lower the soft palate or to raise the tongue body upward and backward, depending on what other synergistic muscles are doing. The palatopharyngeus muscle originates from the hard palate and the palatoaponeurosis. It courses laterally and downward, underlying the posterior faucial pillars, and becomes part of the pharynx. This muscle inserts into the posterior margins of the thyroid cartilage. So given its connections, this muscle can help lower the palate in the posterior part, narrow the pharynx by pulling the posterior part of the pharynx forward, or elevate the larynx by pulling up on the thyroid cartilage. In the use of the velar muscles for speech production, there is an important pair of agonist-antagonist muscles that help control the velum opening and the position of the tongue body. That pair of agonist-antagonist muscles are the Levator veli palatini and the palatoglossus. If you look at, say, the lateral image of those muscles, Levator veli palatini comes from the soft palate and courses upward, so it can raise the soft palate. Palatoglossus comes from the lateral palate and courses downward to connect into the tongue, so it can lower the soft palate. So they basically pull on the palate in opposite directions. If the velopharyngeal port is closed and the soft palate is raised, the action of the Levator veli palatini then would be synergistic to the palatoglossus attempting to, say, pull upward and backward on the tongue body.